Welcome to this ASN Kidney 360 podcast. I'm Divyanshu Malhotra, an MD in nephrology at Yale University, and I'm joined by my co-author, Sherry Mansour, who is also an MD in nephrology at the Yale University. Today we will discuss our article entitled A Comparison Study of Coronavirus Disease 2019 Outcomes in Hospitalized Kidney Transplant Recipients, which is being published in Kidney 360 this March.
Thank you, Div, for the introductions. Why don't we start by discussing with our listeners the key findings of our study?
Absolutely. So we did a study to evaluate in-hospital complications of kidney transplant recipients who were diagnosed with COVID-19, and we compared the rates with other kidney transplant recipients who did not have COVID-19, as well as non-transplant recipients who had COVID-19. We found that kidney transplant recipients who were COVID-19 positive had higher rates of ventilation and vasopressor use, as well as acute kidney injury. Mortality was not significantly different between COVID-19 positive kidney transplant recipients and non-recipients. However, there was a notable trend towards higher mortality, that is 25% versus 16%.
Very interesting, but Div, these are just rates, correct? So can we share with the listeners if the findings persisted after adjusting for confounders?
Absolutely, Sherry. Yes. After adjusting for comorbidities as measured by the Elix-Hauser score, black race, and baseline kidney function, we found that the kidney transplant recipients who were COVID-19 positive had 3 times higher odds of ventilation, 2 times higher odds of pressor use, and almost 2.5 times higher odds of acute kidney injury compared to those who were not kidney transplant recipients.
I see. And how about risk factors? What were some of the risk factors that we identified to likely explain these poor outcomes that you mentioned in kidney transplant recipients?
Sure. Actually, the main risk factor that we identified is kidney transplant status itself. And this could be secondary to immunosuppression use, but our study was not designed to answer this question. So, of course, further studies will be needed. We also identified that kidney transplant recipients who had COVID-19 had higher rates of liver disease at baseline, as well as, surprisingly, higher ferritin levels while in the hospital. But honestly, it is hard to say if these are actual risk factors until the findings are validated in larger cohorts. Moving on, Sherry, do you believe, based on our findings, that transplant recipients should be prioritized to receive the COVID-19 vaccine?
That's a good question, and the short answer is absolutely yes. I mean, we found that transplant recipients are at high risk of developing more complications from COVID, as you discussed, Div, and knowing that transplant patients in general are at higher risk for developing any infection, including COVID, we certainly feel strongly that they should be prioritized to receive the COVID vaccine.
So true. I absolutely agree. Can we also discuss some other clinical implications of our findings, Sherry?
Yeah, sure. So our study findings highlighted that kidney transplant recipients are at high risk of developing COVID-19 complications, and this should really alert clinicians to thoroughly educate kidney transplant patients regarding social distancing, maintaining all CDC guidelines, such as wearing a mask, washing your hands, during the times of this pandemic. And it further highlights the need, as we said, of early vaccination in this vulnerable population.
I absolutely agree. Something that is not fully answered by our study, though, but has strong clinical implications is the role of immunosuppression in COVID-19 infection. We certainly did not find evidence to support that immunosuppression use is protective in this setting, as has been postulated by earlier hypotheses stating that the immunosuppression may ameliorate the cytokine storm associated with COVID-19. To the contrary, we actually found a higher rate of complications in this cohort of kidney transplant recipients on immunosuppression therapy. So to conclude, kidney transplant recipients who were diagnosed with COVID-19 were found to have high rates of mortality and hospital complications such as ventilation, pressor use, and acute kidney injury. And even after adjusting for the level of comorbidity, black race, and baseline eGFR, the kidney transplant patients still had higher rates of these complications compared to the non-transplants with COVID-19. This concludes our podcast. Thank you so much for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition, or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.